Every week, someone sits across from me in my office and says the same thing. I walk every day. I do everything right. So why do my knees hurt? Why am I more tired than I was last year? Why does my lower back ache by the time I get home? And every single time, I ask them one question. Show me how you walk. And that's when I see it. The problem isn't that they're not walking enough. The problem is that they're walking in a way that's quietly working against them. Walking the wrong way doesn't just fail to help you. It actively chips away at your joints, your posture, your heart, and your energy, one step at a time. After 15 years of treating patients over 50, I've seen this same pattern play out again and again. So today, I'm going to walk you through exactly what's going wrong, and more importantly, exactly how to fix it. If this is useful, subscribe and hit like, because what I'm about to share is something you almost never hear in a 15-minute doctor's visit. Let's start with why this even matters. Walking after 50 isn't just a nice habit. It's closer to medical necessity. Here's why. Your body is going through changes, whether you notice them or not, and they're not subtle. The first major shift is muscle loss, a process doctors call sarcopenia. Starting in your 50s, you lose somewhere between 1 and 2% of your total muscle mass every year. That might not sound alarming in isolation, but stretch that out over a decade, and you've lost nearly a fifth of your muscle. And muscle isn't just about looking strong. It's what keeps your joints stable, what helps regulate your blood sugar, what holds your spine upright, and what keeps you from stumbling when the sidewalk isn't perfectly even. Lose too much of it, and the rest of your body starts paying the price. The second shift happens in your joints. Cartilage, that smooth cushioning material at the ends of your bones, doesn't have its own blood supply. It survives entirely on movement. Every time you take a step, fluid inside the joint gets pushed into the cartilage, feeding it the nutrients it needs to stay healthy. Stop moving regularly, and that cartilage starts to starve. It thins. It dries out. Eventually, it breaks down, and that breakdown has a name: osteoarthritis. It isn't an inevitable part of aging, but certain habits speed it up dramatically, and we'll get into those. The third shift is metabolic. Your basal metabolic rate, meaning the number of calories your body burns just to stay alive while doing nothing, drops by roughly 2 to 3% every decade after 50. That means the same eating habits and activity level that kept your weight steady in your 30s will quietly add pounds in your 50s. Not because you changed anything, but because your body did. And the fourth shift is circulatory. Blood vessels lose some of their elasticity. The heart pumps with slightly less force. Blood flow to the legs and feet becomes less efficient. This is exactly why so many people in their 50s and 60s start noticing cold feet, restless leg cramps at night, or a heavy, tired feeling by the end of the day. Here's the part that should give you hope. Walking, done correctly, touches every single one of these four systems at once. It activates muscle. It feeds cartilage. It speeds up metabolism. It improves circulation. Research consistently shows that people who walk regularly have meaningfully lower rates of heart disease, type 2 diabetes, osteoporosis, and even cognitive decline. But here's the catch: nobody mentions. All of that benefit depends entirely on walking the right way. Get the mechanics wrong, and you don't just lose the benefit. You create brand new problems layered on top of the ones you already had. So let's go through the habits I see destroying people's progress, one by one, starting with the very first thing that goes wrong before you've even walked a single block. Habit number 1, launching into full speed immediately. This is the mistake I see more than any other, across every age and fitness level. People step outside their front door and immediately walk at their normal, brisk pace. It feels efficient. Why waste time easing into something you're just going to do anyway? But your body isn't a light switch. It doesn't flip instantly from resting to fully operational, and skipping that transition has real consequences. When you start too fast, your muscles are still cold, and cold muscle fibers are stiffer and less elastic, which makes them far more prone to microscopic tears. Individually, these tears cause no pain you'd notice, but they accumulate, walk after walk, and eventually surface as chronic aches that seem to come from nowhere. At the same time, your joints haven't been lubricated yet. The fluid inside them needs a few minutes of gentle movement to spread evenly across the joint surface. Skip that warm-up, and your cartilage is essentially running dry while you're already pushing it at full pace. And your cardiovascular system doesn't appreciate sudden demands either. Heart rate and blood pressure spike faster than they should, and after 50, when your vessels have already lost some flexibility, that spike puts unnecessary strain on the system. The fix costs you nothing in time. Spend the first 3 to 5 minutes of every walk moving slowly and deliberately. Let your joints catch up. Let your muscles warm. Let your heart settle into rhythm. Then, and only then, pick up your pace. Habit number 2, walking with poor posture. Watch people walk down any street, and you'll notice most of them are hunched forward, head pushed out ahead of their shoulders, eyes locked on the ground a few feet in front of them. It looks harmless. It is not. Here's the mechanical reality. An adult head weighs roughly 11 pounds, and when it sits properly aligned over the spine, your neck muscles carry exactly that load and nothing more. But shift your head forward by just an inch or so, and the load on your cervical spine triples. Push it forward 2 inches, and the load multiplies 4 to 5 times over. That means instead of carrying 11 pounds, your neck and upper back are now straining under 45 to 55 pounds, continuously for the entire walk. Do that for 30 minutes, and you've built the exact recipe for chronic neck and shoulder tension. People blame the weather, or stress, or simply getting older. The real cause is almost always posture. There's a second cost to bad posture that's just as serious but far less visible. When your chest collapses forward and your shoulders round inward, your diaphragm can't fully descend the way it's supposed to. Your lungs can't expand to their full capacity, so you end up breathing shallow, using only the upper portion of your chest, and your body receives less oxygen than it actually needs. You walk for 30 minutes and feel like you've been out there for an hour. Most people chalk this up to age or low fitness. The real explanation is almost always mechanical, not physiological. And there's a third consequence that almost nobody connects to posture at all. Once your head shifts forward, your lower back has to compensate by arching more than it should. Your pelvis tilts. Your knees start absorbing force at the wrong angle. The load on your knees and hips increases, not because you're getting older, but because of one specific, fixable error happening every single time you walk. So how do you actually fix it? Picture a thin string attached to the crown of your head, gently pulling you upward. This isn't about forcing yourself into a stiff, exaggerated posture. It's about letting your spine decompress and find its natural length. Shoulders relaxed, drawn slightly back, not a soldier's stance, just your body's normal alignment. Eyes on the horizon ahead of you, not on the pavement. Chin level, chest open. In that position, your lungs can work at full capacity, your neck carries no extra burden, and your spine distributes weight exactly the way it was built to. Habit number 3, wearing the wrong shoes. This is the one almost nobody thinks about. People plan their walking route, their playlist, their schedule, but footwear gets zero consideration. That's a costly oversight, because for your joints, nothing matters more than what's between your foot and the pavement. 2 things change in your feet as you age, and both make proper footwear essential. First, the natural fat padding on the soles of your feet thins out. That padding used to act as a built-in shock absorber, softening every heel strike. Without it, your shoes have to compensate, and if they don't, every bit of impact travels straight up through your ankle, your knee, your hip, and finally your lower back. Second, the muscles and ligaments supporting your foot weaken over time, and the arch can begin to collapse, a condition known as acquired flat foot. That collapse changes the angle your knee absorbs force at, shifts your hip alignment, and adds extra stress to your spine. A properly built shoe with real arch support can slow that whole process down significantly. So what should you actually look for? First, cushioning, both at the heel and the front of the foot. Soft enough to absorb shock, but firm enough that your foot isn't sinking with no support underneath it. Second, genuine arch support, meaning the inner shape of the shoe follows your foot's natural curve rather than forcing it flat. Third, flexibility at the front of the sole, because your foot needs to bend naturally at the ball with every step. A completely rigid sole disrupts that heel-to-toe motion and forces your calf muscles and Achilles tendon to overwork. And one more thing worth mentioning, shoe age. A lot of people are walking in sneakers that are 2 or 3 years old, and from the outside, they look fine. But the cushioning inside the midsole breaks down long before the shoe looks worn out. If you're walking regularly, plan to replace your shoes about once a year. That's not a sales pitch. That's basic joint protection. Habit number 4, walking rarely, but going long when you finally do. This pattern is incredibly common. People are too busy during the week, so they save it all for one long Saturday or Sunday walk, an hour, sometimes 2. They come home exhausted, feel accomplished, and consider their fitness obligation met for the week. Physiologically, this approach works against you. Your body doesn't respond to occasional bursts of activity. It responds to repeated, consistent signals. Every walk sends your body a message that movement is the new normal. And in response, your heart becomes more efficient, your blood vessels adapt, your muscles strengthen, and your metabolism stays active. That kind of adaptation only happens with regular repetition. One walk a week simply isn't a strong enough signal, so your body never fully adjusts and the benefits stay minimal. Worse, a single long walk after days of total inactivity is a genuine shock to muscles that aren't ready for it. They're cold, they're unconditioned, and the next day, they ache. People often conclude that walking just isn't for them, that their joints are too weak. That conclusion is almost always wrong. The joints are usually fine. The pattern is what's broken. The evidence here is consistent and clear. 20 to 30 minutes of walking on most days of the week is the minimum effective amount for real cardiovascular benefit, the kind that lowers your risk of heart attack, stroke, and type 2 diabetes. Not one marathon walk every Sunday, but 5 or 6 shorter walks spread across the week. Your body only adapts to what repeats. If you're currently doing one long walk a week, start with 3 shorter ones instead, and it doesn't need to be 20 minutes right away. Start with 10. After 2 weeks, add 5 more minutes. That gradual approach isn't weakness, it's strategy, and it's the only version of this that actually works long term. Habit number 5, letting your arms hang completely still. Most people either pin their arms rigidly to their sides, let them dangle without purpose, or stuff their hands into their pockets. It feels comfortable, but it quietly removes a meaningful portion of walking's benefit and disrupts the natural mechanics of the movement itself. Here's why it matters. Walking was never meant to be a leg-only activity. It's a whole-body, cross-pattern movement. Thiek he, ab total 3000 words, hojega 2000 plus 1000. Yahan final section he. When your left leg steps forward, your right arm naturally swings forward too, and vice versa. This pattern, called cross-coordination, is built into your nervous system from the moment you learn to walk as a toddler. It distributes load evenly across your spine and reduces the twisting force that travels through your trunk with every single step. When your arms stay frozen, your spine has to compensate for that lost rotation somewhere else, usually in the lower back. For anyone who already deals with back pain, this small habit can be the difference between a walk that helps and a walk that hurts. There's a second reason arm movement matters. Swinging your arms naturally engages the muscles in your shoulders, chest, and upper back. That means a walk with proper arm motion activates significantly more total muscle than the exact same walk with arms held still. More active muscle means more calories burned, better circulation, and a more responsive metabolism. Same distance, same time, but a noticeably stronger physiological effect just because your arms are doing their job. And there's a third benefit that becomes more important the older you get. Arm swing sets rhythm. It improves coordination. As balance and coordination naturally decline with age, a steady, rhythmic arm movement helps you maintain a consistent stride and reduces your risk of stumbling. So how do you actually do this correctly? Bend your elbows to roughly a 90-degree angle. Let them swing forward and back in a natural rhythm, opposite to your leg movement. You don't need the exaggerated pumping motion you'd see from competitive race walkers. Just stop locking your arms against your body. Within a few walks, you'll genuinely feel the difference. Everything starts to move with more rhythm and less effort. Habit number 6, walking with your phone in your hand. 20 years ago, this mistake simply didn't exist. Today, it might be the most common thing I see. People walk while scrolling, reading messages, checking notifications, fully convinced they're still getting their exercise in. Mechanically, they're not getting the same benefit at all. Let's start with posture again, because this habit makes everything we already discussed dramatically worse. When you hold a phone in front of you, or worse, down near your waist, your head tilts downward even further than ordinary slouching. We already established what forward head position does to your cervical spine, tripling or even quadrupling the load on your neck. With a phone, that angle is often even steeper, which means the load is even heavier. Your shoulders round forward, your chest compresses, and your breathing becomes shallow, layering every postural problem we covered earlier on top of itself, except now it's intensified. Now think about safety, because this part matters even more after 50. Your vestibular system, the balance mechanism inside your inner ear, naturally becomes slightly less precise with age. Proprioception, your sense of where your body is in space, also starts to fade gradually. This is a normal part of aging, but it means your brain leans more heavily on visual input to stay balanced while walking. When your eyes are locked on a screen instead of the path ahead, your brain loses its most important source of spatial information. You stop noticing uneven pavement, curbs, loose gravel, or wet surfaces until you're already off balance. The risk of falling increases substantially, and a fall after 50 isn't a minor inconvenience. It often means a fractured wrist, fractured ribs, or in more serious cases, a hip fracture, which for someone over 60 can mean surgery, extended immobility, and a long, difficult recovery. The fix here is refreshingly simple. Put the phone in your pocket. If you want music or a podcast, use earbuds, but keep the screen out of your hands entirely. And there's one more reason this matters beyond just safety. Walking isn't only physical exercise, it's a neurological one too. When you walk while actually paying attention to your surroundings, your breathing, the rhythm of your steps, you're training attention, coordination, and spatial awareness all at once. That's a real, measurable benefit for your brain. The moment you switch your focus to a screen, that benefit disappears completely. Your legs keep moving, but your brain has checked out. Habit number 7, skipping recovery after your walk. This one almost never comes up. Not in a clinic, not anywhere. There's a common assumption that walking is such a light activity that recovery simply isn't necessary. That assumption is incorrect. Start with hydration. Muscle tissue is roughly 70 to 75% water, and every biochemical process your muscles rely on, contraction, relaxation, repair, happens in a water-based environment. Even mild dehydration, just 1 to 2% loss of your body's fluid, measurably reduces muscle elasticity, slows recovery, and raises your risk of cramping. A glass of water after your walk isn't a marketing line from a sports drink commercial. It's basic physiology, plain and simple. Now consider stretching. While you walk, your muscles work primarily in a shortened, contracted state, over and over again. Without stretching afterward, they stay slightly shortened even once you stop moving. Over time, this builds up. Your muscles grow tighter, your joint range of motion narrows, and a persistent stiffness sets in, especially noticeable in your calves, the backs of your thighs, and your lower back. Just 5 minutes of gentle stretching after each walk prevents almost all of that buildup. And finally, rest days. Many people assume that if walking is good for them, then more walking must always be better. That isn't how your body actually adapts. Adaptation doesn't happen during the exercise itself. It happens during recovery, when muscle fibers rebuild stronger, when joints remodel in response to the load they absorbed, when your cardiovascular system restructures itself to handle the new demand more efficiently. Skip recovery entirely, and that adaptation simply never has the chance to occur. 1 to 2 rest days a week isn't laziness. It's the correct, evidence-based protocol. Think of your walk not as a standalone task you check off a list, but as one part of a complete system. Movement, hydration, stretching, and rest, working together to produce results that actually last. Here's the clinical reality that ties all 7 of these together. Every single mistake we've covered carries a heavier consequence after 50 than it would at 30. Poor posture, worn out shoes, skipped warm-ups, missing recovery. All of it does roughly 2 to 3 times more damage now, simply because your joints, blood vessels, and muscles have less resilience to absorb the impact of a bad habit. The exact same mistake your body once shrugged off without consequence will now show up as a real, noticeable symptom. So here's exactly what to do, starting with your very next walk. First, give yourself a real warm-up. The first 3 to 5 minutes of every walk, slow pace only, no exceptions. It costs you nothing extra in time. Second, check your posture right now, even sitting where you are. Straighten your spine, lift your head gently, relax your shoulders back. Memorize that feeling and recreate it the moment you step outside. Third, go look at the soles of your walking shoes. If they're unevenly worn or older than a year, it's time to replace them. This is one of the simplest, highest return investments you can make for your joints. Fourth, stop saving all your movement for one long weekend walk. Aim for 20 to 30 minutes, 5 to 6 days a week. If that feels like too much right now, start with 3 days and build from there. Fifth, let your arms move naturally. Bend your elbows, relax your shoulders, take your hands out of your pockets. Sixth, leave your phone in your pocket for the entire walk. No exceptions. Use earbuds if you want audio. And seventh, after every walk, drink a glass of water and spend 5 minutes stretching. Walking remains one of the most accessible, safest, and genuinely effective tools you have for protecting your health after 50. No gym membership required. no expensive equipment, no complicated preparation, just the right habits applied consistently and a little conscious attention to how you move. Small corrections in the way you walk can produce real, lasting improvements for your heart, your joints, your brain, and how you feel every single day.